able to send this out to everybody, or I can certainly do so to make sure everybody has the right link. I found it once I realized I was incorrect.
Excellent. And
I'll send it out just to make sure.
Thank you very much, Councilmember Benedict. And I see that Councilmember Toombs has joined us. Thank you very much.
Do we know how many we need for quorum? We have 10, but do we know how many people we need for quorum?
At having 50%, I'm going to ask our chair.
Oops, it says I'm muted. I believe 50% is what the bylaw says.
Perfect. Excellent, excellent. So our first piece of business are the minutes from the last meeting. Can I get a motion for approval?
Move approval.
Second.
Thank you. Motion passes. And so I'm going to jump right to you, Sam, so you don't have to endure anything else. Rosie, can you make Sam a presenter, please?
All right. Thank you so much for having me. I am going to share my screen. All right. Can you see the PowerPoint now?
Oh, we can. And Sam, would you give us a brief introduction to?
Yeah, I will. Sorry. So my name is Sam Williams. I'm the manager of the Financial Empowerment Center and Network. I've been with United Way of Greater Nashville for about 2.5 years, but am 16-year Nashvilleian, small business, nonprofits, all of the things. So I'm here to tell you more. Most of you have some sense of Nashville Financial Empowerment Center. Here to remind you a little bit about it and share with you some of our 2020 data. The reason I'm coming to the Women's Caucus is because 70% of our clients are women. Now I have some theories on why that is, we can talk about later, but we do know that the financial burden for low to moderate income families relies heavily on the women. And we do know that also unemployment and folks stepping out of the workforce during COVID has also fallen more heavily on women because of childcare and remote schooling. So it's an even more poignant time to kind of look at what our service is and where we fit in the public services available for Nashvilleians. So this is the fun stuff that everybody likes to hear about the Financial Empowerment Center. Our big numbers since inception, we have helped clients reduce debt by $16.5 million and increase their savings by $3 million. This is particularly, this doesn't even begin to capture the economic impact of how much more people have saved in interest on better car loans because they brought their credit score up, or having a reduced debt load. I wish we could have a full economic impact study at some point. But like I said, these are the big numbers everybody likes to see about our service. Since inception, we've served 8,400 clients and 24,000 financial counseling sessions. Before I go into the 2020 in-depth data, I should step back just a second and just make sure everybody is clear. So Financial Empowerment Center is a program of the mayor's office implemented by United Way of Greater Nashville. It is part of a national movement. Nashville was one of the first 5 cities 8 years ago to provide one-on-one professional financial counseling as a city service. Started in New York, Bloomberg Philanthropies is spreading it. We're at about 40 cities right now. Memphis has one, Jackson and Knoxville have applied. Chattanooga has a relationship with Bloomberg Philanthropies as well. So we're working on kind of a statewide collaboration at some point too. It's really nice. Nashville gets to be one of the national leaders on this. We serve as an expert city. So it's something for the city to be really proud of. So the 2020 data, we have a really powerful Salesforce-based platform. The reason everybody loves those big numbers is we're so tangible and measurable. Eric Cole used to say, you know, we're like apple pie. Like, who can argue, who can be against like financial stability and empowerment work where we're really helping folks move forward, like really stick financially and take control of their situation. We have no income restrictions. We serve anyone and everyone in Davidson County. And you'll see we clearly have a client base, but we're available to everybody. Whether you're in chronic financial situation, a crazy crisis comes up like COVID, unemployment, tornado damage, or if you're relatively stable, but you want somebody to check your math and make sure that you're on the right path. And we have a young attorney who she's making fine money, but she's got a credit card problem and really needs to kind of move forward with student loans and stuff. So the data is really lovely because we have we can pull Experian credit reports, but that's how we do credit reporting with our clients, is we pull Experian reports directly into our system. And so we really get true numbers on their debt load, on their delinquent accounts, on what their credit score is. We will tell clients not to obsess about the score. The report is what matters. Work on that and the score will come up. Don't obsess about Credit Karma. But the data is important not just to impress stakeholders and funders and council members about the effectiveness. It's also to help us improve our internal service, our processes, improve our partnerships. You'll see the referral sources later and how we can do that, but also how to target our marketing, build towards policy and systems change. Well, I said that statewide collaboration would be huge for us because, as you know, with preemption, Nashville and Memphis have to have support across the state to do anything. So if we want to get to a situation where we can look at flex loans and the danger they are to our community, we need a statewide base for that. We can talk more about that if anybody wants to another time. We try not to collect data just to collect data. We want to use meaningful data because we know it's sensitive information for our clients, and honor the fact that we try to check our assumptions about the measures and the meaning, to look at it with a variety of different lenses. So, like I said, I'm a data nerd here too, so there's some fun stuff. Just for 2020, the number's still pretty impressive. 2.3 million in reduced debt, considering we were in an economic crisis. 160,000 in increased savings. That's 1,800 total sessions. The total number of clients I should have on here, but it was 700 new clients. And some of the demographics you'll see are particularly around new clients. The retention here at the bottom, the pink is really our sweet spot. 3 to 6 sessions is when people can really kind of dig in and get some stuff done. We have clients who've been with us for a long time that need a little more hand-holding, or were with us for a long time ago and came back. And then the one sessions, I don't necessarily fault clients or counselors for that. Some folks just aren't ready. They'll come in and pull their credit report and it's just too much to deal with. Or they, especially if they got referred by a social service agency, sometimes it's too soon after a crisis to come in. And often we have people that they just want their credit pulled, or they just want somebody to check their math, and then they feel like they have it under control. So we'd like to have that one session number lower, but also we feel like we do a good job that it's up to the clients to come back if they want to engage with us. So, that's a constant discussion point across FECs across the country. The referral types I think are interesting this year. We were able to add prospective clients to our database, and so now we can track, say, Catholic Charities has a hard referral and they send in a client that they have permission, they send them in directly into our database. And so then we call the schedule, we set up an appointment, and if either we can't schedule or they no-show, we can keep track of that, so then we can make the relationship with Catholic Charities better to say, why did this person get lost, I can tell you, community-based organizations, Habitat, their people show up. Like, Habitat is a very unique relationship that if they're coming, if they've talked to Habitat and they got denied the first time, they're going to come see the FEC so that they can get approved the next time. That's one of our best relationships long-term. Friends and family, we love to see, like, that means our work is hitting home. And then they're sending folks that they know to us. The internet relations to our portal with the mayor's office, and that includes socials. And then some of the other has been employers. We've been really trying to work with employers some more. We've had a lot of therapists lately sending clients, which I think is interesting. We're trying to kind of work that angle a little bit more around mental health. Often what we've seen with clients is if folks are in counseling, they're in like talk therapy counseling, they're ready to do the work around the finances. So it's really been really successful for the clients and for the counselors. Let's see my notes here. Like I said, and the community-based organization breaks down really nicely with specific nonprofits, and they have what is called a hard referral portal. So they send those people in, and then we can report back to them, like even on how many sessions people had, stuff like that. We have data sharing agreements. Zip codes, this is council, this is significant to council. I don't have all your districts and zip codes memorized. There's also a data report that was attached to a newsletter this week, and I can send you guys the link to it that give actual numbers on each of the zip codes. The light blue here you'll see is Conexión Americas. They provide our Spanish language counseling. So we have 7 full-time counselors, with one of those being, like I said, Conexión Americas. We subgrant with them or subcontract with them, and they our office admin is bilingual, so everybody kind of funnels through our main number and portal, and then we schedule with our Conexión counselor. We also have a counselor that works with Nashville State, TCAT, young adults, and we have one that serves the Family Collective, which is families at risk of or experiencing homelessness. And we recently got 2 expansion counselors. The national folks gave us 2 expansion counselors for COVID relief specifically, and so we're expanding, trying some new partnerships and stuff because we have increased capacity. Map is helpful. This would probably works really well with districts too. You can clearly see, I mean, our current almost former location is right here. We are just off of the Spring Street Ellington split in Sam Levy is where our physical location has been. We've been virtual, for a year now. And MDHA is actually reclaiming the space. So we are looking for new space. If anybody has any ideas in their district for us, we've got some possibilities. MDHA is helping us trying to find something. We're talking with general services and trying to figure out a good spot for us. I do think we are underrepresented in North Nashville. Family Collective is working really hard there, and we've had a counselor sit various times at Magruder. I think we're still way underrepresented there. But I don't think that when we look against the poverty maps, I'm not surprised exactly where our clients are coming from. But this also helps us target our marketing and things like our socials to where we know we have a solid client base and where we want to have more. Speaking of poverty levels and stuff, this is our household income breakdown. As you can see, almost all of our clients are below local median household income of 60K. With that, the bulk of our clients being from 10,000 to 40,000, it's even more impressive the kind of numbers they can do around debt reduction with the counselors. Let's see. Again, fun data we can pull out of having Experian credit reports. Only about 8% of our clients have very good and exceptional credit. The majority, more than a quarter have no score at all. And that can be for a variety of reasons. They can have only negative stuff on their credit report. They can just have not enough in file. There also could be, and this is particularly in the Latino community, because of naming conventions, there are often like split files and merged files because the credit reporting system is not good about keeping track of which names to use where, and it's very frustrating for our folks. We're still trying to sort through if there's anything better we can be doing around that. But those are the hardest credit reports to figure out. But the majority of our clients have very poor to fair credit. And that's what most of our work is on, improving credit scores and reducing debt. Okay, this is another interesting data point. This is the types of debt that our clients have. I mean, we knew student loan debt was going to be a lot, but this is just clients we saw in 2020, and they have $23.5 million in student loan debt. You know, we would say home mortgage debt is good debt, but it's still debt. It's still a burden on folks. And we used to say student loan debt was good debt, but it's still debt, and people still. That's one of the main things we work on folks with too, is student loans. Trying to get people in the right payment plans, and kind of reworking things, consolidating, getting them out of default. You know, that we're not surprised at. Some of these, we were surprised that collections and credit card debt were not higher, honestly, because that's the kind of bad debt that people would assume that you come in and you're working on. Medical debt often is not on credit reports. We work a lot with folks on medical debt. And payday and flex loans do not show up on your credit report also, or title loans. So this is just what is coming from credit reports. Yeah, flex loans don't show up in your credit report. They don't send it to collections, they sue you. So there's a whole nother system for dealing with that. Let's see. I think I mentioned this already, that we have not had as many, no, I didn't, that was a previous presentation today. We have not had as many clients affected by COVID as you would imagine. Our 2020 clients, only 34% were affected by COVID. And my theory around that, and coming from, we're also at, you know, United Way, Tracy Deal that you've worked with around CARES funding is my boss. We know the kind of full scale of crisis and financial assistance that people are needing this year, have needed last year, this year. And so our theory is that all the folks that are getting the rent assistance, utility assistance, eviction prevention, they don't have the bandwidth yet to do some of the things that we could help them with. And so we'll back around with, with all of those folks that were helped by the Financial Assistance Network. When they've got 3 or 6 months under their belt of kind of stability, we'll be working back with them so that we can help them kind of weather the storm better next time. I speak really quickly, so if we'll have plenty of time for questions, but 2021 plans, we're going to be doing a lot of marketing. We've got some extra funds from expansion to just do a big blast. We have increased capacity, and so we're really trying to get the client flow happening. I'm doing a big partner refresh. There's so many agencies that we've worked with in the past and want to work with in new ways, because they're all doing things differently right now too. We're looking for a new space. We may have to split our team up. Davidson County can get really big, and so we may be looking at 2 smaller hubs. Some of the really cool stuff that is happening with Judge Bell's housing court and some of the homeless prevention work that's happening. One of our financial counselors has a master's with public policy, and so she's helping with that eviction prevention work as well. Kind of on the, not the back side, but on the research side, she's got a group of grad students at Vanderbilt that are going to be kind of digging in on the data to kind of really look at what Nashville's eviction problem has been like. Not so much on the like immediate work that Judge Bell is doing right now, which is spectacular. Also this year, just like I said, the program is growing, and so we've had some national leadership opportunity, which is, you know, that's a great thing for Nashville to be able to participate in. And on the national scale, on the national scale, I actually had yesterday I had a call with an FEC person in San Antonio, and they had heard what we did around the tornado, and how the FEC was able to jump in to provide solid financial information, to get legal aid, to, you know, put together a sheet about contractors and gathering your documents and stuff around disaster recovery. And so I was able to kind of walk him through, like, this is what's going to happen. You got to get out in front of the contractors. FEMA's going to take a while. So it was neat to be able to kind of provide that to other people in the community because it's something that we've gone through ourselves. I would be in trouble if I didn't share a VITA reminder with you. The VITA free tax prep program, it's not my program, it's my colleagues at United Way, but provides free tax preparation for any household making less than 66K. They are almost entirely virtual this year. There are a few sites that are taking appointments, some that are taking just doing intake and helping take pictures of documents in person, but then the actual IRS trained volunteers are doing it all virtually. So it's a really slick system. They worked it out last year and now they've got their rhythm, but this is something really easy to share with constituents and just really significant this year, especially with folks on unemployment. The returns are going to look different. And then I have to always just put up the number and the website for how to refer people to us. What questions do you guys have? And how can I be helpful to you as a Women's Caucus, as you're working on other projects within council? I want to be a resource, not just come to you asking you to share information.
Well, first, can we say thank you for coming, Sam? This was very helpful information, and we do have some questions. So the first hand that I saw was Councilmember Evans.
Thank you, Chair. I have two questions. One was when you were talking about the refers for your community-based organizations, you had mentioned Catholic Charities as an example, but are they the largest refer, or somebody else within Nashville refer more clients to you all?
I mean, we work with so many of them. We have a lot of Catholic Charities, a lot of Safe Haven. Habitat is a huge one. MAC and MSS. It is really across the board with agencies. If you've got any new ideas, though, I'm happy to reach out to whomever.
Okay, thanks for listing some of those other ones. And then the other question I had was when you were talking about pulling credit, Experian credit reports and kind of walking through that information with clients, do you also kind of deviate into, some of the other sides of credit, like related to, I hate to say debt consolidation, but some of that negotiation side, like related to like if a client has a high interest credit card, are you helping them with negotiating that interest rate as part of this process? Or if they have identity theft issues, are you helping them down that path too?
Yes, absolutely. Our counselors are very highly trained. I love and respect what they do. They have strategies that I never would have thought of before. And they've seen it all. And a lot of the collections agencies, they know which agencies are going to take what settlements. They know, which credit cards are the best to send new people to. So they walk through folks through all of that, really. I mean, we aren't a debt management we can't offer a consolidation, but oftentimes the counselor will walk through it the first time with someone. They want to call in and offer a settlement. We'll do it on the phone together the first time. And then then we make a call list and you follow through on these. It's really, we take the empowerment part seriously.
Yeah. Okay. Thank you for that. That answers all my questions. Thanks, Councilwoman Stiles.
Thank you very much, Councilmember Evans. Next, we have Councilmember Van Rees.
Hi. Good afternoon, everybody. Hi, Sam. Thanks for helping so many people out in District 8 over a number of years. I've been a big fan of FEC since it started, as you know, and we were seeing quite a bit of uptick when you guys were kind of holding shop, if you will, at the Madison Library, and I know that meant a lot. I know that trying to get more locations as we move hopefully into maybe the autumn or whenever that is, that people can do that. One of the things that I had questions on, and you may have covered it, I came in a little bit late, was a little bit more of a breakdown in regard to the folks that you're helping, if they're single moms, if they are families, kind of that sort of breakdown, because it seems that perhaps you're getting more people coming to help more than one person as opposed to a single individual. Can you help kind of give some perspective on that?
That's something we're actually, in terms of a data integrity point, we're really trying to focus on this year. And I could pull it out pretty easily with new clients' household size. It's not something that I have readily available, but you're absolutely right. These are not all single individuals. These are households. These are people with kids.
Do you find the majority of the clients are female asking for help, or is it even?
Oh, yeah, I started with that at the beginning. 71% of our clients are female.
Yeah, I would love to know how many of those females are single moms, or if they have another person in the household. That I think would be helpful.
And we have found, at least anecdotally, that even if there are two people, or if it is a wife and a husband, that sometimes the woman is coming unbeknownst to the other partner, and trying to get things organized. We've had a number of domestic violence things where folks are trying to come and get their ducks in a row before they can get out. I'll dig in more on the families stuff. It's an important data point we need to have on our public facing stuff.
Did you have any other questions, Councilmember Van Rees?
No, thank you very much. Thank you.
Excellent. Sam, the graph that you showed us of the zip codes,
yeah,
I know you had mentioned that you would share that with us. Could you possibly compile all this information that people are requesting and send it to Rosie?
I can put this in the chat.
To Berkeley, forgive me. To Councilmember Allen.
I just put in the chat, it's our 2020 data report. So you can just go and pull the PDF. The charts are a little different than what I showed in the PowerPoint, but it is the hard data on everything, and some of the same charts and information that I share with you, just in a little different format. But it's a nice PDF. The one other thing I'll have to pull is that household size.
Excellent.
Thank you. Get that to you.
Councilmember Porterfield. Councilmember Porterfield. Okay, we will come back to you, Councilmember Sepulveda.
Thank you, Councilmember, and thank you, Ms. Williams, for coming to speak to us today. So two questions. One is those graphics that you showed us, are they posted on any social media platforms so we could share that, or have they been emailed to us? Because I would love to share some of that information.
Yeah, they have. I just put the link in for a slightly different version, and then I can actually send you that slide deck as well. Some of them, so Nashville Financial Empowerment Center does have a Facebook page, and we do we don't necessarily put our data out on the Facebook page, but all of the shareable things like our service, the VITA program, all of that, it's really easy to share from there.
Great. Okay, thank you. I'll make sure to share that out. And thank you all for also reaching out to the Hispanic community and working with Conexión Américas to reach out to that community. My question is if you have resources for reaching out to other communities, translation services or anything like that, or would you like some recommendations on some organizations that might be able to help with that? I'd be happy to do that as well.
Yeah, we primarily have used Language Line over the years. I would love to get counselors in other languages. When Family and Children Services lost their financial navigator position, I really wanted to scoop up all of their multi-language staff, and we didn't have the money at that point. But I'd love to talk to you more about if there are other organizations you think we could be partnering with that we could serve with. If we had better translation services, that'd be great. I know language line is a certain limitation. I should also say we work closely with Bridges for the Deaf and Hard of Hearing. We have one counselor that's dedicated to them. And so we have a really strong relationship kind of working with their interpreters and a very focused section of their clients.
Great, thank you for that information. I'd be happy to reach out. I know that having these graphics in different languages also be helpful to reaching out. So I'll make sure to reach out to you separately and see if we could connect you with some other groups.
I don't have the graphics. I don't have this presentation in any other languages, but we have our materials. All of our marketing materials are in Spanish as well. So I can get you the flyer and the graphics and stuff, and Conexión shares them as well on their stuff. They've got a video. We both have videos about free tax prep too that are on socials that are good for sharing.
Great, thank you, Ms. Williams.
Thank you.
Thank you very much, Councilmember Sepulveda. Councilmember Hauser.
Thank you so much, and I do appreciate learning more about.
Councilmember Hauser, you're on mute. Still on mute, Councilmember.
Okay, I think I'm now okay. Sorry, I was just going blank on there. Yeah, I did not realize till today that you were actually part of the mayor's office. I always thought you were part of United Way. So that was something that I learned. One of the frustrations that I often find in the nonprofit world is that many organizations want to be able to say they do everything. And when they do everything, they do nothing really expertly well. And I appreciate those who know what their market is and what they do really well and concentrate on that. But one of the things you mentioned was your collaboration with other organizations. Is there a spreadsheet, or could we create somehow a spreadsheet that says Miss Jones needs service A, Q, and R? Who provides those specific services so that you can take those people in? Because I think one of the frustrations is for people to know where to go for what, and they can get so bogged down. Is there such a tool, or is that something that United Way might be able to create?
I can't speak for all of United Way, but there are, I would love to see better coordination across. I think you have a really strong point about organizations that think they can do everything. It's the same thing about which organization is going to compile this or take the leadership role, because there's still some territorialism around that stuff as well. I don't know if the city has a role in that or not, but I know, well, Charity Tracker is the one that they're using with the CARES funding, and it is a tool that multiple organizations can see specifically funding that is wrapping around a person to meet all of the needs they have. There's 211 that you can call and get all these different services. I think for what you're suggesting, I think it would be better if I think it would be great if we had a better resource list for who has case management, because to put a spreadsheet that this person needs C, E, and F, it really needs to be a case manager that's walking through all of that with them. And our counselors, we're very quick to say we are not case managers, we're not social workers, we just do financial counseling. So we want to be in that component with them, but that's not our role. I would love to see that happen. Not sure where.
Yeah, I've mentioned to different people over time, and as you say, having someone who's ready to take it on, and it needs to be an active life thing that can be changed. But it's extremely frustrating for folks when they're truly trying to get help, but they don't necessarily know where to go for which part of it. And oftentimes the counselors at various organizations are not necessarily tuned in to who to send them to for other services. And I really see that as a hole that we have in our systems. There's so many people wanting to do so many things. And, you know, people fall through the cracks because they don't know exactly where to go. And there can be a key element that doesn't get filled, and then they get discouraged because they're trying so hard and it's not working. So that would be one of the bugs I'd like to put in somebody's ear to create.
Oh, I absolutely agree. And like I said, even if there's just this entry point of these are the organizations that have case management that can walk through all of this with you, and then they pull in, I think coordination of services could come a long way.
Right, and making sure the case managers know where to send them, but that would be great. And I appreciate what you are doing. This is so vitally important. Thank you.
One of the things we did right after the tornado and as COVID rolled out was a webinar series that we had about 150 direct service folks, case managers and folks that came on because new information was coming out so quickly. And so that's one of the ways that we could be doing better of making sure everybody knows what's happening now.
Right. Thank you.
Thank you very much, Councilmember Hauser. We have a last question from Councilmember Henderson.
Thank you, Councilor Stiles. Hey there, Sam. Thank you so much for all you do. Always really impressive presentation and good to see the work you're doing. I wanted to ask in the context of the pandemic and doing more meetings online. I know that kind of varies by communities and access and kind of what that's meant. If you see it as, a positive generally, I think a lot about, I can't recall if it was Councilor Van Rees or somebody alluded to, but, when folks are in kind of a domestic violence situation where it's, challenging and they're trying to get all their ducks in a row before they can leave. I have heard so often, and just even in one kind of circumstance, knowing someone personally, like that finance piece was it for them. Like they had to get that kind of figured out. And so I'm just thinking about, kind of being in a household, sometimes the barrier is getting out and getting to meet with somebody in person. Sometimes the barrier is I can't conduct this meeting in my house without the person who's trying to harm. I guess I just wonder if you have any thoughts on how the online is kind of helping, hurting, how is that a factor for the service, and anything that you want to kind of keep after the pandemic, because we're talking about that a lot, what might retain?
Absolutely. So DB is a very specific segment, and that, like you said, that really is complex and when it would be helpful or harmful to be virtual. And I will say, most of our clients are opting for phone. They're not opting for a video chat. We try to encourage the video chat the first time just so we can kind of make a person-to-person connection. But if they're more comfortable on the phone, we can do most of this on the phone. Or the counselor will jump on just to share screen if they're looking at the credit report. But most folks do just prefer phone. My counselors love it, being able to work virtually, and we will keep some of that. Kind of depends on what our space ends up looking like. The clients have really, our no-show rate is down. Clients, the counselor texts them and say, hey, it's time for our appointment, and they're much more likely to answer the phone than they are necessarily, if you had to drive and come over to the location, something can come up much easier. So our show rate's been much better. We're definitely going to keep virtual as an option. We hope people will come in person though.
That's good to hear. Just one follow-up question. Is there an expectation of confidentiality? How does that work with your services? Can you speak to that?
We have strict confidentiality statements. Clients have to sign a waiver to work with us. They when we share information back out, it's all deaggregated, and they also sign a waiver for us to be able to pull their credit report.
Thank you very much, Councilmember Henderson. Councilmember Porterfield, are you with us? Still want to ask a question?
My apologies. I think my hand was from, I don't know where it was from because I didn't raise it, but thank you for that wonderful information. So thank you. Oh, and The Minority Caucus reception does start in 15 minutes, just an FYI. I don't know if we'll get through the rest of the meeting, but I just wanted to make sure everybody was cognizant of the time.
Thank you, Councilmember Porterfield.
Sam, great questions. I didn't expect it to be on this long, so.
Well, you brought such great information. It just created more questions to delve into. So thank you very much for joining us. If there's additional information, if you can send it to Councilmember Allen, and she will disseminate it to the rest of the caucus. And otherwise, thank you for putting the link in the chat. So we'll be able to hold on to that as well. Thank you very much for your time this evening.
My pleasure. Thank you, guys.
So, ladies, that brings us to new business. And at our last meeting, we discussed who we wanted to have attend our meeting for next month, for Women's Month. And we have 3 individuals, actually. One was Dr. Wright to come and speak about how things are going in terms of vaccinations. Chief Drake to come back and follow up on how things are going in terms of domestic violence and of course the statement that we had put out a few months ago, but then also Shannon Hall in regards to the updated version of the Metro policy. And so that policy has been completed. So I'm going to send it to Councilmember Allen to send to all of us to review and give our thoughts. I think they did a good job of incorporating what we asked for so that Metro now has their own way of reporting. So out of all the options that women can have to use, Metro now has a set way as well. So I'm going to ask, since we've had one guest this evening and it kind of went long, it looks like we should probably decide who we want for next month. So I see Councilmember Henderson's hand. Is that a new hand or an old hand?
It was an old hand, Councilor Stiles, but I would vote for either Ms. Hall or Chief Drake so that we can kind of circle back and make sure to deliver on the things that we have said we were working on before we start with a new informational type meeting.
And excellent. Thank you very much, Councilmember Henderson.
I can't find my little hand to raise. I apologize. I'm in some whatever. I have extended an invitation to Chief Drake and it does fit his schedule. So if it's okay, then I will try to line. I did not hear back from Mr. Wright, Dr. Wright, sorry, but I can ask Chief Drake. I mean, Chief Drake has already got us on his schedule, and I can reach out to Ms. Hall for April. We also talked about Awake, and Councilmember Hauser has given me that that link as well. So if that needs to be the May meeting, then I can make all those happen.
Okay, so for next month, we have Chief Drake. Right. April will hopefully be Shannon and Diane. And then you said May, is that Dr. Wright or for Awake?
I'm open to suggestions for the group on that.
Okay. Well, since we are in February, we could circle back and talk about what we want to do in May. So for now, at least we know next month's guest is going to be Chief Drake, and we know that April will be coming back to circle back on our language for the new process for Metro. So that is good. Okay, here we go, everybody. It's bylaw. It's bylaw time. Everybody get excited. Okay.
Councilmember Stiles, can I interject real quickly in case I have to?
Yes.
I just wanted to let you guys know that the resolution acknowledging Diane Nash as part of Women's History Month is being written. Metro Historic had a delay, so we missed the deadline for the first meeting, but you'll see it come up in the second meeting. So I just wanted to make sure that you guys knew that to be looking for that, but that's it's underway and it's beautiful. The information will be on it. So just wanted to make sure that you guys knew that was coming.
Thank you, Councilmember Van Rees. Councilmember Porterfield, I see your hand. I'm going to assume that's a fresh hand, right?
It is, and it's very fast. Thank you for acknowledging me. To piggyback off of Councilmember Van Reese. I apologize. I was supposed to be writing one for Black History Month. I thought that I was supposed to be helping for the Diane Nash for March, so I did not write one for Black History Month. So my apologies that I did not do that. I am so sorry. I looked at the minutes before the meeting and I realized that I had it mixed up in my ever so busy brain. So my apologies, ladies. We did not have one for Black History Month. Please forgive me and don't kick me out of the caucus.
We will not.
I wanted to say something clever, but that just made me laugh, so it went out of my head entirely. So thank you though, Councilmember Porterfield. So I'm Rosie, can I share my, you know what? Councilmember Allen, since Councilmember Porterfield and Toombs and Sepulveda, we have to depart. I'm going to forward you right now the mission statement that Councilmember Henderson and I worked on.
Okay, I will look for that, and we'll join y'all at the reception as quickly as we can. So let's try to be efficient here, as we promised. I'm looking. Have you sent it? There it is. Okay, downloading. Okay, I will, Rosie, now can you enable me to share my screen? I'm also trying to save this real quick in case something happens.
Councilmember Allen?
Yes.
I just gave a whole little speech and I didn't realize I was muted.
I was talking away. What did you say?
So I wanted to tell everyone, since I'm going to depart while you all are going over the bylaws, I wanted to invite you that when you get a moment, if you'll go to the Minority Caucus, the new Facebook page, Nashville Metropolitan Minority Caucus, we will have, the program will be on that page. So if you need to go back later this evening, you can watch it. It really is quite good.
We're headed there shortly.
Biased.
Okay. All right. Yeah, my hope is that we can do this quickly and join you for most of it. I think that's our goal. Rosie, can I share my screen now?
You should be able to, Ms. Allen.
Okay, let me find it. I think this is it. Okay. I'm sharing my whiteboard. All right, I think there were just a few pieces left in the bylaws that we wanted to talk about, and I appreciate the people that have worked on this. Does this look like the right version? I still have so many on my computer. Councilmember Henderson, can you tell me if I've gotten the right version up here or not?
It is.
Great.
That's the, and just to let you know, Councilmember Henderson suggested an update on our description. So you'll see that in the first sentence. The mission of the Women's Caucus of the Metropolitan Council of Nashville.
Okay.
And I thought that was a sound change.
Okay.
And then the mission just kind of tweaked it a little bit.
Okay, let's let everybody read it.
Or the caucus will seek that section that's highlighted. It may be verbose, but I think it encompasses everything that we want to say.
It looks fantastic.
Okay, I think that's great. Any further comments or additions to that, or do we accept that as a group?
Looks great. Thank you for your work on this.
Yeah. I think teamwork. There was one other area that we were looking at. Did y'all work on, I think there was one other question about policy resolutions. was there an opportunity to work on this wording?
Councilwoman Allen, this is Councilwoman Toombs. I emailed you some language.
Okay. I will have to go find that right now. Okay, and I think sponsorships was the other question. Did we, are we at peace with sponsorships may be allowed only for community events open to non-members of the caucus?
I'm okay with that.
Other comments on that?
Anyone else?
I think it's fine to keep it as is. It's simple.
Okay, we're gonna unyellow that. No color. Okay, and then if I can find the email from Councilmember Toombs very quickly, I'll get back to that in a second. Let's see. Give me just a moment to look for that. Let's see. Was that, how far back should I have to look for that, Councilmember Toombs?
I sent it today. Let's see.
Let me go back to my inbox.
Councilor Allen,
yes.
If I may, I think this section 4A, my apologies. I know I had volunteered to assist Councilor Stiles and Councilor Toombs vis-a-vis the mission statement, but I think as well I had maybe made a particular comment about this section 4 Part A, and so I apologize that I did not follow through on that particularly. But I think my thought here, and that may align with what Councilor Toombs sent you, but you know, the caucus may adopt official policies and positions on issues that are a focus of the members. I would just say align that sentence with our mission statement, right? On issues that are aligned with our the mission statement or something like that. That would just be my suggestion, but I don't want that to preclude what Councilor Toombs sent that I have not seen, but just kind of off the top of my head as we're kind of pausing for waiting here.
Yeah.
Councilwoman Allen, I just resent the email to you.
Okay. And it maybe, here's something, section 4 resend. Great, thank you so much. I appreciate y'all working with us. We're gonna get this. Okay, it is opening. We're gonna look at it. And then maybe we will be able to adopt the bylaws, which would be great. All right, I'm downloading this. Okay, it's opening. All right, that we've already looked at. Okay, we're going to section 4A. Okay, so let's look at that. The caucus may adopt official positions on issues that are pertinent to the mission of the caucus. These positions may take the form of official statements issued as a caucus body and/or formal resolutions or bills introduced to the full council. Resolutions or bill drafted on behalf of the caucus to address these positions shall be submitted in writing to the council office 30 days before. Ooh, this is good stuff. And a majority vote of the membership shall be necessary to adopt any resolution or bill submitted pursuant to this section. Not adopted by a majority of the vote shall not be filed on behalf of the caucus, may be filed by individual caucus members. I think that's great. Other comments on the work that Councilmember Toombs has done? Shall we adopt this language? I think Councilmember Henderson, that does incorporate your suggestion about referring to the mission of the caucus.
Councilmember Allen, I have to say this looks fantastic.
I agree.
It's very clear.
Other comments?
Particularly for C's, knowing that if we don't adopt it as a group, you can still pursue it as an individual.
I agree. Okay, I'm picking up these 3 sections and taking them into the working document then. Here we are, maybe.
Councilor Allen, I want to commend Councilor Toombs and Councilor Stiles as well. I mean, this is good work, and I know we're all very kind of tired of this, but I don't know if Council Teams just worked on this section, but I mean, I would welcome her touch on the whole thing too. And I was going to say, you know, I know we want to get this to the finish line, but I think too, I don't think there's any harm in just waiting to next meeting, kind of getting all in one document so that we don't feel crunched here on the Minority Caucus event at 6. So I just want to commend
May I
my
second
colleagues.
that?
They've done great work. And I think, you know, let's just give it one more turn, one more meeting rather than everybody working, engaging, and then just kind of trying to hurry up at the finish. So thank you.
I think that's a good suggestion. Is that acceptable to the group?
I second that motion.
Okay. I think that's a fine plan. Okay, I am getting it all into one document, and we will hold it until the next meeting, which means we do not have an accepted policy for electing officers, so we will not do that at this meeting. Okay, but that has now been put in. And so maybe we will actually get us back to going back to our agenda. So we'll skip election of officers. Old business is simply, I guess we can talk briefly. We're set for March resolutions. Councilmember Van Rees is working on the Diane Nash resolution. Councilmember Stiles, I have taken over to allow you to jump out if you need to, but if you would like to finish this meeting out, I will allow you to do that as well. Let me know what your pleasure is, and I'll keep talking or be quiet.
Well, you know what? I think I can wrap this up in a meeting before.
All right, wrap this up.
In a minute, I should say, because I can see your screen just fine. Okay. So, key issues. I think this is something that we should talk about in our next meeting, to go over these to be sure if anything has changed or how we would like to address these in terms of the air quality, early childhood education, the police task force, Silent No More, HR COVID related issues that have to do with women. I think that is something that we should ponder in the next month. There were some things that I had brewing that I wanted to share. So in terms of action items, it looks like we're all just going to be reviewing this document. Are you going to put it together, Berkeley, and the Councilmember Allen, and then send it out to all of us so we can look at it?
Yes.
Okay, perfect. So our next meeting is March 23rd, ladies. Look forward to seeing you then.
Please don't schedule other meetings on top of it.
Yes, please. And with that, our meeting is adjourned.
Thank you all. Good work.
Thank you.
Stop sharing.